Hello, Assalamu alaikum. Okay, so let's start our today's webinar, and you must be knowing that your instructor, Dr. Sanamjit, and today's webinar for Introduction to MRCOG exam, how to book the exam, how you can prepare for the exam. Okay, so at the end, if you have any question, you can ask me, or if you find any difficulty, you can ask during the session as well. Okay, so what we'll be discussing today, the importance of this MRCOG exam, like what is actually this MRCOG and why you should go for this exam, and how you can apply for this MRCOG exam. So basically, there are few steps for the registration, and if you don't know, like you are new to this MRCOG, so you will be getting benefit by listening to this video, and you can easily step by step all the steps I will be telling you, that how you can register for this exam and what you actually required for this exam, like how you can apply. And then the after application, the preparation methods, that what is actually included in this exam and how you can prepare for the exam. And at the end we'll be also discussing also about our long course details, that what how we'll be dealing with the course details. Okay, so this is our agenda of today's webinar, and we'll be discussing all these things. Okay, so let's start our today's webinar. Okay, so first comes this MRCOG exam, like why you have to go for this MRCOG exam. So you must be knowing that what actually it stands for. This is a membership exam for Royal College of Obstetricians and Gynecologists. Okay, and you all know that it is an international exam and it is a prestigious degree. Your competency level will be increased, you'll getting more job opportunities as well, and also you can have a GMC registration as well, and also this IMC as well, because it is this MRCOG is recognized in UK and Ireland as well. Like you can get both the registrations, like GMC also. You can just skip the PLA pathway when you are when you just clear all the pathways of MRCOG, then you can get the GMC registration as well. Okay, so this is a very prestigious degree, and like the current the situation of our country as well, everybody is going for these international qualifications. So this is a very you can say the very competent exam. You'll be seeing that if you have studied, if you are all the details, then you can easily go through this exam. Okay, so what actually includes in this MRCOG exam, they have three parts, like part 1, 2 and 3. And you all must be knowing that these two parts, part 1 and 2, they are your written exams, like they are your paper exams, so they are theory exams, and part 3 is only your clinical exam. Now what actually includes in part 1, your part 1 is actually only about your single best answers. All the questions would be your single best answers, will be having 5 options, 5 I think, 5 would be there, and you have to choose the best option. Like 2 can be correct, but the best option you have to select. So single best answer is the paper pattern. And this part 1 actually it covers your basic and applied sciences, only relevant to the obs and gynae. So basics means all the basic sciences as well, all the domains of basics, like starting from the anatomy, physiology, genetics, embryology, all these topics, the basics, whichever thing apply to the gynae, that will be included in this MRCOG part 1. And part 2 actually it is also a written exam. It includes this SBA, single best answers, and also the EMQs. The EMQs are your extended match questions. So you will be familiar later on whenever you need. So these EMQs are actually a little bit tricky and difficult as well. So basically both these paper, they are the written exam, and what actually is the basic requirement to go to this MRCOG pathways, the very simple thing that you just need to have a simple MBBS degree. Like after MBBS, you know that the Pakistani students get their PMDC, and if you are in any other country, you know that your local the registration council, you just have to be registered with your council. So just this basic qualification, basic medical degree is required, and your registration with your local council. Okay, so this thing is the basic necessity of going through this MRCOG exam. And for both these part one, even if first you give MRCOG part one, and then you can, even the next, you can easily go to the MRCOG part two. If you think you are capable enough, you have studied all these things, then you can directly go to part two. There is no requirement of any experience up till these two steps. Okay, so the house job, you know that the house job is the basic in our setup, everybody is doing. So even you can give this exam part one without house job as well. It is not a requirement of that. Okay, so after part one and part two, no experience up till these two papers is required. But whenever you have to go from part two to part three, so before part three, here is the experience requirement starts. So here the experience is actually that you need to have a 4 full years working in the obs and gynae. So the 4 full years are required. Now some students must be having a confusion that either it is the training, it should be a training, like in our country we have FCPS training. It is not mandatory that it should be a training. Okay, but you know that the training is easily get approved. So basically this is actually the, later on you will be having this form, this AOT. This is the assessment of training form. So it doesn't mean that it should be a training experience, but any experience, like you just need to have a 4 years of experience, but it should be like in a, either in a private government hospital, but it should be under some, you know, the consultant gynecologist. It should be, it can be a private hospital, not a very small clinic, you say that, but it should be under some gynecologist, and they show that you are working in obs and gynae department. Okay, for 4 full years, and even these 4 years should be recent. This is also a mandatory thing in that. Should be recent means they should not be l- less than 2 years old. They should be less than 2 years old. Okay, not more than 2 years old. Like if you have done even the even if it is your training, like you have done the training in 4 years back, then they will not approve your uh, training as well now. Okay, so this experience should be recent. And also a very important thing is that, like if the few students they have doing a training, or they have done the training or anything, this AOT can be done, can be approved anytime. Like just you give part one, MRCOG part one, the next step you can go for this AOT. Okay, and it will be approved for your lifetime. And anytime you want to give part three, MRCG part three, you can use that AOT. Okay, so this was actually confusion between the students, that they think that the experience is required for part two. So this was actually an old school of thought, but now they actually, the experience is required only for the part three. Okay, so part one and two you can easily go through them, these two steps, without any experience. Okay, so who can give this part one exam? So I have told you earlier that only you required to be having an MBBS degree, and your degree should be in English or translated in English. Okay, so the best time of giving this part one, because we have discussed that it is actually a basic science exam. So whenever you are going through any your local training exam, the entry exams, which is FCPS part one exam, like in Pakistan, so at that time, your basics would be very strong. You would be having grip on your anatomy, physiology, and all those subjects. So the best time for part one is that, but you can give at any time. Okay, so because whenever you have experience, you are working in any gynae department, you will be having these things would be very easy for you to go through them. Okay, so now the all three parts are now in doing in Pakistan. Like first two, part one and two are already in Pakistan, and part three will be starting actually in this May 2025. So hopefully part three will also be conducted in from now onwards would be in Pakistan as well. Okay, so you must be knowing that, okay, this is just the basic requirement. The prerequisite is just you need to have your MBBS degree. Okay, so these are the very important dates and your fee structure. So it actually, this exam occurs two times. Okay, two times a year. One is January exam and the other is your July exam. Okay, so January has already been done, and now the next upcoming exam is for July, which is 1st July 2025. Okay, and these are the three dates, very important dates you need to remember. So we'll be discussing later on in detail. So your part one eligibility deadline, like you have to submit your eligibility application before this date. You have to submit your expression of interest before these dates. So you have a plenty of time. Like in March, these things will be these dates will be ended on. And a very important date, whenever you will be like all the registration process will be discussing with today, you are done with that, then you will be your booking window will be open up on this date, 22nd April. This date would be very, very important for you, that the booking is actually very easily booking of this exam. The seats will get filled even in 1-2 hours. Very, very quickly the seats get filled up. So you can say that if you want to give exam, you have to book it as soon as possible, like on the same day. And even you can say that in the same first, or you have to book your exam. Okay, so this is a very important thing. You need to be very vigilant for that. Okay, you cannot say that, okay, booking opens for 1.5 months, so you'll be getting the seat. No, they have just very limited number of seats. Either they have started the Pearson View centers, but still their seats are limited. So you have to be very quick in the booking procedure, and your result would be after 30 days. This would be your date. Okay, so now the fee structure is in the band forms. This band B, you have to see that which country your band, with the country your falls in which band. So band B, actually Pakistan lies in the band B. So your fee structure is your £572, and for today's the fee structure is 198,000. You can say the 200K. So this is the current rate of this MRCOG part 1 exam. Okay, so now how to apply for this MRCOG exam. So these are the three basic steps you have to do right now. The first step is your RCOG account formation. The second is your eligibility application. And the third is your expression of interest form. So these three things, you are done with your registration process. Now you have to then wait for your approval of this eligibility application. And when they will give you the mail that you are eligible for this MRCOG1 exam, then you will be book your exam on that date. Okay, so this only step would be left, and these three steps you have to do it right now. Okay, so just go through the quick step that how you can make this go for the registration. So first is the RCOG account. You just go to the official website. It is your rcog.org.uk, and you will be seeing this kind of website, and just you have to sign in or register by clicking on this, and then you have to register and you have to create an account. So first time, all the newbies, you have to create an account on this RCOG website, fill up all the details, relevant details, email address. Now this email address is very, very important, because this RCOG account and your email recovery, these would be your going through all the parts, okay, for part 1, 2 and 3. So you have to be the email address, you have to use that one, which like the password or everything is safe, like you know that this email ID is safe and you are using it, and you will be not be forgetting the password as well. Okay, so they will be sending a verification code, and then you verify your account, you add all the details like address, everything. See, everything will be in your RCOG account. They will be knowing that, okay, what is your country, the address, all these things, and then you need to sign in with your details. Okay, so after sign in, you will be going through this page. This will be your RCOG, you can say the account opening, and here would be your name written, and below that would be your college number. So this is actually the very important number. This college number would be your, you can say, the future respondents number. It will be, this number would be using in all the your 3 exams, and this will be remain the same. So for that you need to remember very you need to remember all these email addresses, your RCOG account details. You can write down at any paper or in any mobile, you can say in the notes, you can write your email ID and the password, so you do not forget all these details. Okay, and also the college number, it is very important. Okay, so you will be getting this college number, it is very important. And the second step, now the first step has done, the RCOG account has already been made. Now the second step is your eligibility application. So for that, you just go to the RCOG official website. Again, you just select your MRCOG1 exam and you can fill the application online. Previously, the application was filled by in the form of PDF, but now it is the online application procedure. Okay, so this is how the your website look like. You just go to the exams, and you just, there's written how to apply. So first step, they have given you that, okay, first make an RCOG account, and then the second step is your apply for eligibility. Okay, so now there are 2 criterias, like are you do you need to send an eligibility or you not need. So what is the difference? All the new candidates, like you are all, if new to the MRCOG, you are the new first time candidate, you have to submit this application. This is very important. You have to be eligible for the exam. So you first have to first send the eligibility application. But for those students, they have already done the previous MRCOG, like they have already done the part 1 once in last year or anything before. So you are already eligible. Now you do not need to send the eligibility application. So one time you give eligibility application, you send it, and you are eligible for lifelong. Okay, so at any time, like before in the past, you just send the eligibility application and they have tell you that, okay, you are eligible, so you can just go through that. You don't need to send it again. Okay, and okay, see, I have applied and had my eligibility approved for a previous exam. Still, you do not, if you are, did not give the exam, but you are eligible for exam. So you are already eligible. You don't need to give it again. Okay, so this is a very important thing. that you just have to send this eligibility application only once. Okay, so now you just enter this eligibility form, and this would be the next step is your expression of interest. So these are the three steps we'll be discussing now. Okay, so now the eligibility application, whenever you open up, first they will be telling you the details, like you are for GMC registered accounts or the non-GMC registered accounts. Excuse me, 1 second. So sorry for interruption. Okay, so let's restart it again. So what I was telling you, that you must be knowing that in the eligibility application, you'll be seeing that either you are GMC registered candidates or non-GMC registered. So you must be knowing that, okay, we are non-GMC, we are not working in UK, so we are non-GMC registered accounts. Okay, so just go through that. These are the things you need to know. You need to have this RCOG account number, your medical registration number. So medical registration number is your registration, like your local registration body. If your Pakistan's or Pakistan PMDC number, your government issued ID card is required, and these can be your ID cards. Okay, so either your national ID card, you can go for that, or you can send a license, passport, your birth certificate. All these things can be done. And the last thing is your medical degree certificate. It is your MBBS. Okay, so only these three things are required for your registration. So documents must be in English, they are legible, they should be legible, and all that. Okay, so processing time. So whenever you send the eligibility application, they have already tell you that the minimum 4 weeks is required for your approval. So you have to wait for at least 4 to 6 weeks, and then you will be getting a response from the RCOG. Now you just click on the start application, and then your application will be in this form. Like it would be stepwise procedure. It would not be a whole form would be there. So stepwise, if you go through that, first is your RCOG account number. You write it down here, your 6-digit account number, and that was in your RCOG account. And then you apply as GMC or non-GMC registered. So you must be knowing that you are non-GMC registered. You add all your details, your email address. See, the email address should be again the same as used for your RCOG account. So these few details are very important. You have to follow these steps. And then your gender, your date of birth, your ID card, the name should be same on your ID card and all your degrees. Okay, this is also a requirement. Now you can add up your upload your government issued ID card. It can be, the size is very you can say it large, 25 MB, up to 25 MB you can upload. And then after that, this ID, this would be your medical qualification details. Now the medical registration number, again your PMDC number would be here, your medical qualification, what it is in your country, your MBBS, your university name, your country of the degree. Okay, so these are the details you have to add on. And now you just medical degree certificate or medical registration certificate. Either you upload your MBBS or you can upload your PMDC, or you can upload both. There's up to you, because here you can upload one file here and one file here as well. So you can upload both these things. Okay, so these are the few things you just, it's a very easy step. There's nothing difficult in this registration process. And this ethnicity diversity monitoring, this is an optional thing. If you want to add on the religion, the ethnicity, you can add on. And the last step is your privacy statement. Just check mark on this, and then this is a signature detail they have added. You can just write your name. Okay, there's nothing like that you have to sign it up, or if you have any device that you can copy your signature here, that is also possible. Okay, and then just submit this your application. So the second step would be done, your eligibility application would be done. The last step would be your expression of interest. Now, the difference between eligibility and expression of interest is that for every exam, like if you have like eligibility, we have discussed that you have to just send it once only and you will be eligible for lifetime. But the expression of interest is that you have to send the expression of interest every time if you want to give this exam. Like if you say that if you sent the expression of interest last year because you want to give exam last year July, but you did not give the exam, so if you want to give this year July exam again, then you have to send this expression of interest form. Okay, so this is that you have to send it again. Okay, for each exam opportunity it should be a new expression of interest form. Okay, this is a very important thing. And they have written that first time candidates, they can submit before their eligibility application. Like you don't know that you either you are eligible for application or not, but you can just fill out these 3 steps. Like you just send the application and just send the expression of interest as well. Okay, because the deadlines we have already discussed that they would be ending on March some date. So you don't need to wait for your eligibility approval. You just send the expression of interest as well. Okay, so this is the website and you just go for the start application, and these are just very small step of this expression of interest. Just add again your RCOG account number. See, always your account number would be adding on in all the steps. Your name, your email address, and the last step is your privacy statement, the check mark, and then you just need to go for the submission of this expression of interest, and you just get an automatic response that okay, your form has been submitted. Okay, you will not be getting any email reply for that. Okay, so this was the whole procedure of your registration process of MRCOG. So if you have any confusion up till now, you can we can discuss or at the end of the session as well. Okay, so up till now you will be, if you want to give the exam in July, you have to submit these, you have to fill out these 3 steps. Okay, RCOG count, eligibility application, and expression of interest. These 3 should be done right now, and the rest, last step would be the exam booking, and that the when the date opens, the booking window opens, and then you will be applying for the booking. Okay, so coming to the preparation for MRCOG exam, like how you can prepare. So first, the paper format should be discussed. We have discussed that it is the SPAs would be there, and now the exam is the computer-based exam. We have 2 papers, 2.5 hours duration, 100 SPAs in each paper, and each paper counts for 50% marks. Like you have to just combined passing marks should be required in the paper. Like it is not that you have to pass each paper. Okay, so no negative marking, no minimum score, and the pass percentage is actually varies between each paper because they are using the percentile method. They do not use that it is a percentage of exact like 70 or 65 anything. So it varies between the papers. Like if the paper they think that it is tough exam, the candidates have find a difficulty in solving the paper, then the percentile actually falls. But if they think that the paper is easy, most candidates have attempted it very like very correctly, so the pass percentile would be higher than that. Okay, so this actually varies between papers. There is no set standard or criteria of the pass percentage. Okay, so you will be getting 2 papers, and these are the 14 modules of the MRCOG Part 1 exam. You will be having like they will be dividing 7 in both exams. So in first papers we'll be having the anatomy, embryology, physiology, endocrinology, biostatistics, biochemistry, and genetics. Okay, so all these topics would be here in this paper 1. And paper 2, the rest of the topics, like you can say the smaller one topics, the data interpretation, immunology, biophysics, pathology, microbiology, pharmacology, and clinical management. Okay, and the question distribution, actually it usually varies, but usually in the paper one, the anatomy is the most carrying questions, and in paper two, the data interpretation as well. Okay, but you cannot say that this is a very important module, and if you see that like this genetics, they have lesser question numbers, like 8 to 10, sometimes less than 8 as well, but you cannot say that it is having less weightage, because in this MRCOG exam, they usually give weightage to each question differently. Like they can say that, okay, these anatomy questions are very easy questions, the weightage of that question is less than the single question of genetics. Okay, so genetics questions might have more weightage in exam. So solving genetics questions correctly would be giving you more marks than solving all the questions of anatomy. Okay, so this is a kind of difference in between or local papers and this international papers. So they would be actually dividing that, the tough criteria, the hard, like this is a harder one and this is a like easier one. There would be difference between that, but you have to cover all the modules in all the for the paper. You cannot skip any module. Okay, even if you don't like biostatistics is actually a module which actually many candidates, they find it harder to understand, but still there are few pet questions from this biostats and you can just easily remember that. So you can skip one or two topic as well between this in this biostat if you just do not find it, you could not understand it, but you cannot skip a whole module. Okay, so they might get more weightage in exam. So every module is very very important for exam. You cannot skip anything at all. Okay, so coming to the preparation, these two books are important, very very important for your preparation. So this is the essential revision guide for MRCOG part 1, and this is actually a very you can say a detailed book. You can have a good understanding of each and every module by reading this out. And this Oxford revision notes, it is actually, you can say, like a book which is actually giving you in a point form, the bullet forms, all the basic, all the very important points would be there in this Oxford revision notes. But it would be difficult to understand if you do not have any background knowledge or background understanding of that topic. You would be having a difficulty in understanding this Oxford revision notes. Okay, but you need to cram it, you need to memorize all these topics. Now one actually you can say the disadvantage of these two books is that I think this has been edition, I don't remember, I have to see it again. I think it is into not 15, 18, I think. Like it is a older one books. These two books do not have any recent edition. So actually the problem is that because these international exams, they actually renew their guidelines every year, every few monthly they updated their guidelines. So what is the problem is that, like, you know, that anatomy will not be changed, will never be changed, anatomy, embryology, even physio, endocrinology. But the few topics like this data interpretation, so the values data interpretation, you can say that they would be changing, like wise the studies evolves, so the values change. And also this clinical management, actually it is a very important, the clinical management, the clinical topics would be there from the basic gynecology. So these are actually from the, you should be reading from very updated source, like the official guidelines. So for these few topics you cannot rely on these books because these are older uh, edition books. And also the microbiology. In microbiology, the infections, because the infections are very they actually, you can say that a very uh, loving subject of these RCOG. So they usually update their guidelines, herpes, syphilis. So these guidelines are very updated. So again, few things would be different from the books. Okay, so you cannot cram up all these things, but the basics would never change. So these books are, both books are very good. You just need to read out these books. And the very important thing is that after reading the books, you need to practice as many questions as you can. So whichever book you find it in market, or whichever thing. So for the first is actually the pass MRCOG is very important. This is a some, but you get an online subscription as well for the updated version. But the few older ones like 2022, 2023, they are coming in the market as well, in the hard copy as well as in the soft copy. So pass MRCOG are very good and important. And also the recalls, yeah, they are very recall questions as well. And you can practice like this. Andrew Caesar is also very important. This BMJ, this Catherine. Okay, so 2 3 books you need to practice, because you practice more and then you will be getting more practice of solving this SPS. Okay, so this is a very important thing. You can practice as many books as you can, as you have the time. Like now you are having 5 months. We are actually 5 months before the exam. So this is a very perfect time to start with the MRCOG. So just start with the basic books, the slow and steady pace. And then after finishing each module, just practice down all the questions from these MCQ books. Okay, so this would be a very important step for your preparation. Okay, so coming to our course details, that what we'll be discussing in our course. So we'll be starting today would be the introductory webinar. So we'll be taking starting from this week. So you'll be having a 5 month duration course and live sessions. All the modules would be covered in the live sessions, and you'll be having 2 classes every week. And after finishing each module, you will be getting a test. So you have to uh, practice the module, that how well you have studied that module. And all the recordings of the live classes will be available after every class, and the PDF has already been provided to you, like all the lectures that I have delivered. So PDF would be given to you so that you can revise from that PDF. Don't solely rely on the PDF, because I still give you that say that you have to read the books. The book reading is very important for exam. Okay, so because usually the paper actually it comes, if you ask other people, they say that 60% usually come from recalls, usually. So 60% is a huge number, but still you need to understand everything, because the recall question, they can just change one thing in that recall question. So you need to have a good understanding. And also what I have discussed, that this usually it can be the happen that few questions have less weightage and few questions have more weightage. So whichever questions they are adding new, they might be having more weightage as well. So you cannot say that you have correctly solved the 60 questions and you will be having the 60% marks. It cannot be there. Okay, so you need to understand, you need to have a good grip of the all the basics. So we'll be discussing at the end of this course, we'll be also discussing all the recalls, this papers of last 5 years. So I'll be suggesting you to go for last 5 years. Don't go into very like 10, 20, 10, 15 years recall, because the older one, more you go into the older recalls, the more you will be getting confused, because those recalls were at the time of that time. Then at that time the guidelines would be different, so the question pattern would be also be different. And now the guidelines has changed, So the guidelines are actually updating every yearly. Mostly guidelines are there, they update every year. So just stick to the 4 5 years. Recall questions are more than enough for practice. It is just for your practice. It is not for the memorization, just for the practice. Okay, so this was all about our today's webinar. We'll be discussing, we'll be starting our classes from the next week. 2 days I have to fix. If you have want to say anything, like you want any specific day, you can tell me that, because 2 days would be, we'll be fixing it the 2 days, and the timing would be like 9 or 10 p.m. That would be, so I think that would be perfect for you people. So you can say that if you want any change in the day, so you can tell me that. So this would be your course, and you'll be discussing all the learning all the paper in that. Okay, so any question? This is our course schedule. How we'll be going through all these modules, starting with the anatomy, because a very big module. So anatomy we have divided now into 3 parts. So I'll be giving like 3 weeks to this, only this anatomy. Okay, so you have plenty of time. You can just go slowly and just read out all the modules. Okay, so this is the course schedule we'll be following for the July exam. Okay. Okay, so any question up till now, or you find any confusion for the registration purpose, or any at any point you can ask any question? Okay, no question up till now. Okay, so let's end our today's class.